Welcome to ETMC TV and this informative presentation by Hugh Babineau, MD, who will discuss obesity and weight loss surgery. Thank you for choosing ETMC TV.
I'm Dr. Hugh Babineau. I do general and bariatric surgery here in Tyler since 2001. We have different categories of obesity. There's obesity, which is considered in the range of anything more than about 25 pounds overweight, roughly, depending on a person's height and so forth. And we have moderate obesity, we have severe obesity, or a term called morbid obesity that many people have heard of. And this term morbid obesity, partly it's just a calculation. We measure a person's height and weight, and if they're roughly 100 pounds over what's considered normal weight, that's about what's considered morbid obesity. The term morbid in there implies that there's morbidity, which is a medical term for consequences, health consequences to the obesity. So a person might have morbid obesity if they're 75 pounds overweight and they also have diabetes and high blood pressure, for example. Again, just the more a person weighs, the more overweight they are, the higher the chance of type 2 diabetes, higher the chance of high blood pressure, higher chance of cholesterol or triglyceride problems, which all of these things lead in turn to more heart problems, to more medical problems, to shorter lifespan. In a way, weight gain, weight loss, managing weight is very simple. Calories in, calories out. If you consume more calories than your body needs, your body turns it into fat, saves it up. The only way to lose weight is to consume fewer calories than your body burns. And we say, well, that means diet and exercise, right? Yes, that does. The surgeries help a person consume fewer calories, which gets back to my first point about how do you lose weight, reduce your calories coming in. And I'm a specialist in that type of surgery called bariatric surgery. People call it weight loss surgery. Either one, they mean the same thing. And there are actually a number of different types of surgeries. There's really 3 right now that are considered standards, and I can touch briefly on each of them. There's adjustable gastric band, known as lap band. That's a brand name, but that is the most common type of adjustable gastric band. The doctor can adjust how tight the band is, again, to help a person reach that right level of restriction where they can feel full on less food. That's the goal. The second surgery is gastric bypass, and most people have heard of this, and it involves reducing the stomach to a much smaller pouch of stomach, about 10% the size of the original stomach. And then the stomach is also connected differently to the intestines. And so this has a number of effects. One is restriction, feeling full on less food. It also makes people more sensitive to the high-calorie foods. And then third is sleeve gastrectomy. We remove about 3/4 or so of the stomach, make it much smaller, and this has similar effects. A person feels full on less foods. It affects their appetite, which again is a good thing. We want people less hungry who are trying to lose weight. And it will make them more sensitive to certain types of foods. So the end goal is the same, help people consume less. And we call the surgeries, whichever one we do, the adjustable band, the sleeve gastrectomy, or the gastric bypass, we call it a tool. And we say, like any tool, you have to use it. Have to use it right, and that's how you get results. Obesity has been such a negative impact in people's lives that when they are successful in losing 50 pounds, 100 pounds, 200 pounds, they feel so much better. And they're very happy with that, as you would expect. Fewer medications, fewer medical problems, more energy, just feeling better. It's really dramatic and very satisfying. The success rates with surgery are much higher than the success rates without surgery. So with surgery, success at keeping off at least half of what a person needs to lose ranges from about 75 to 95% success rates. Without surgery, most studies less than 5% success. So that is, even though surgery is not 100%, it's drastically more effective than no surgery on the average. The decision to have weight loss surgery is a big decision. It's a serious approach to a serious problem. So don't take it lightly. Make sure that a person going into surgery knows that weight gain, weight loss, it's still all about the calories. Surgery doesn't change the rules. You still have to change what you eat and become more active. And those are really the main things that I want people to know who are thinking about weight loss surgery. Like so many conditions, I think the first place to start is with a person's primary care physician. Find out what is your height, what is your weight, what other medical problems do you have. Are you considered overweight? Are you considered obese? Are you considered morbidly obese? And go from there. The Surgical Review Corporation is an entity that was founded to establish centers of excellence, which is a designation for a hospital, surgeons, staff, etc., who meet certain requirements for experience, for volume, for low complication rates. And that is one way to help educate oneself about the different options out there. East Texas Medical Center and my practice have been designated as a center of excellence since the program was started in 2005.
Dr. Babineau performs weight loss surgery at ETMC in Tyler and sees patients at the ETMC First Physicians Clinic at 1100 East Lake Street. For information or to make an appointment, please call 903-593-0230. Dr. Hugh Babineau is a board-certified surgeon who is designated as a bariatric surgeon of excellence. He has performed more than 3,000 weight loss surgeries since 2001. Dr. Babineau earned his Doctor of Medicine degree at the University of Rochester Medical Center in New York and performed his residency in general surgery at the Mary Imogene Bassett Hospital in Cooperstown, New York.